Radiotherapy can cause side effects in the area of your body that is being treated. You may also get some general side effects. After treatment finishes, it may be 1 to 2 weeks before side effects start getting better. After this, most side effects usually slowly go away.
Generally with pelvic radiotherapy for gynaecological cancer, you wouldn't be expected to start experiencing side effects till you're about halfway through your treatment. Everybody's different. Some people are a little bit earlier. Some people don't develop any side effects at all, but you will be seen weekly in the review clinic where a member of the team will always listen and assess any side effects you have and give you appropriate medications if necessary.
You are unlikely to get all the possible side effects of radiotherapy. The side effects you may have depend on the area being treated, whether you have internal or external radiotherapy, how much radiotherapy you are having, and whether you are having other cancer treatments like surgery, chemotherapy, or hormonal therapy.
When we use the word fatigue, we don't mean exhaustion. We just mean that you might need to take little rests every now and again. You might need to manage how you are dealing with your activity, but we certainly don't want you to stop everything because regular, gentle exercise can actually be very helpful.
Fatigue and tiredness are common side effects that may last up to 2 months after treatment. Try to get plenty of rest and pace yourself. Balance this with some physical activity, such as going for a short walk. Eat a healthy diet and drink plenty of fluids. And ask others for help with everyday tasks.
So with radiotherapy to the pelvis for a gynaecological cancer, we wouldn't generally expect you to have a severe side effect with your skin unless you are having treatment to the vagina or vulva. For patients having radiotherapy for endometrial cancer or cervix cancer, generally as long as you look after your skin and follow the advice that you're given, we wouldn't expect you to experience a skin reaction. For patients undergoing radiotherapy to the pelvis for either vulval cancer or vaginal cancer, it can be a little bit different. You can get a severe side effect with your skin reaction, but we do support you with this and we do have steps in place to try and minimise that as much as possible.
Skin reactions usually start about 10 to 14 days after your treatment starts. Have showers rather than baths, and try to use a gentle stream of lukewarm water. Wear loose underwear or shorts made from natural fibres, and avoid tight-fitting clothes. Do not shave, wax or use hair removal creams on the treatment area. And protect the treated area from the sun for the first year after radiotherapy.
You can get bladder irritations, which can mean that you need to urinate more frequently, and when you've got to go, you might really have to go. But usually it's manageable. We do often ask you to increase your fluids when you're having pelvic radiotherapy, and obviously the fluid that you take in has to come out. So as well as the side effects directly related to your radiotherapy, that increase in fluid intake can mean that you do need to urinate more frequently.
Try to drink plenty of fluids. Aim to drink at least 2 to 3 litres of fluids every day, which will make your urine paler and less concentrated. When choosing fluids to drink, try to drink more water and less of drinks that may irritate the bladder, like tea, coffee, cola and chocolate. Try to limit alcohol, fizzy drinks, acidic drinks and drinks with artificial sweeteners.
Radiotherapy to the pelvis with your bowel side effects, you can expect a change in your bowel habits. So some people find that their bowels become looser, they may even develop diarrhea. For some people they develop urgency, they can sometimes be passing wind more often, and sometimes you can pass a little bit of mucus with that wind as well.
Try to limit drinks containing alcohol or caffeine. Avoid food and drinks that give you wind, like pickles, beans, curry and fizzy drinks. Do gentle exercises to help with wind. Or try taking charcoal tablets which you can buy at the chemist, but always ask your doctor or pharmacist first, as these can affect other medications.
Following on from your radiotherapy, we would normally give you some aftercare advice, which would include the use of dilators. And the idea of that is to ensure that any changes or scar tissue within the vagina is kept to a minimum and that you're able to maintain your sexual function. With radiotherapy, we can cause narrowing of the vagina, we can cause shortening of the vagina, and we can also cause for increased levels of vaginal dryness. The team looking after you will always be able to give you advice on that. It will involve the use of dilators and the use of lubrication as well.
Lubricants are a gel or liquid that you can use inside your vagina to make it wetter. Vaginal moisturiser is a cream you can apply to draw moisture into the vaginal walls. If you've had the menopause, vaginal estrogen as a cream, small pellet or ring can also help, but it's not suitable for everyone. Your doctor can prescribe these products. Lubricants and moisturisers are also available online or over the counter.
Any women undergoing pelvic radiotherapy will inevitably, if they haven't already gone through the menopause, go through an early menopause. During your radiotherapy, you probably won't notice any changes other than you may find any periods that, if you were still having them, become less lighter or may even stop altogether. Once you enter your follow-up, if you start to develop any symptoms of early menopause such as hot flushes, we can either look at whether or not HRT is appropriate for you if that's something you're interested in, or we can look at complementary therapies such as acupuncture, which can be really helpful.
Having an early menopause can be difficult to cope with and can be distressing. Ask your doctor or nurse for support, advice and treatments. Hormone replacement therapy is treatment to replace the hormones that the ovaries stop producing during menopause. It's not suitable for everyone, and you should ask your doctor or nurse for more information.
Unfortunately, some women who undergo pelvic radiotherapy for gynaecological cancer do develop long-term side effects. This is often referred to as pelvic radiation disease. There are resources that we can help you with, and this is something that we're developing at the moment to enable us to be able to support women better with this.
Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
We absolutely understand that it's a very difficult, emotional time for women undergoing treatment for the gynecological cancers. And often what I tend to see is actually when you're having the treatment, you're just focusing on getting through a day at a time, and it can often hit you at the time when you finish the treatment, and suddenly, you have a lot of time on your hands to think about your diagnosis, to think about what's happened. And what we would say is, please pick up the phone, please reach out to us, and we can organise counselling, we can organise clinical psychology support to help you through that.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.